Welcome to my channel. When a mother conceives, her body undergoes significant hormonal changes. Due to the effect of this hormone, various symptoms become apparent in woman's body right from the beginning of pregnancy. At present, with the availability of information on the internet, many people are well aware of these pregnancy symptoms. Those who are attempting to conceive should pay extra attention of these symptoms. Sometimes, even with all the signs of pregnancy, menstruation can still occur. Many sisters want to know why menstruation occurs despite all the symptoms of pregnancy, or if pregnancy does not occur, why do symptoms of pregnancy appear? So, in today's video, I will discuss about why does menstruation occur despite all the symptoms of pregnancy. So, let's get started. Before that, we need to understand some basic fact. Every month during a specific time in the menstrual cycle, women undergo ovulation, which is the release of an egg. After ovulation, the level of the hormone progesterone increases in the woman's body, and about 1 to 2 days before the start of period, there is a sudden decrease in progesterone, leading to the onset of menstruation. Observe the chart. Notice how the level of progesterone decreases just before the state of menstruation, and then it increases again after ovulation. However, when someone becomes pregnant, the level of progesterone continues to rise after ovulation, and it does not decrease before the period starts. Pay attention to the chart. Therefore, the purpose of this discussion is to highlight that the symptoms experienced by women during pregnancy are due to the presence of progesterone. Now, let's discuss our main topics. Why does menstruation occur despite all the symptoms of pregnancy? Normally, after ovulation, the level of progesterone increases in women's bodies, actually preparing the mother's body for conception. Due to this rise in progesterone, sometimes the body may feel weak, there might be mild breast tenderness, bloating, and slight abdominal discomfort. Those who are trying to conceive may mistake this symptom for a sign of pregnancy. However, when the period comes, it can be disheartening. In reality, these symptoms are not indicative of the pregnancy, but these symptoms are called premenstrual symptom or PMS. But it is true that even though conception has occurred, similar symptoms are often manifested. So the question arises, how do we differentiate between these symptoms of conception and premenstrual symptoms? Pregnancy symptoms primarily occur shortly after a missed period, while PMS typically occurred after ovulation. Therefore, if you notice such symptoms about 10 to 12 days before expected period date, it is more likely to be premenstrual symptom, not pregnancy symptom. Number 2. For those who are trying to conceive when seek medical advice, doctors often conduct various tests and examination. They may prescribe some progesterone-like medication or injection that primarily help in pregnancy. However, the use of this conception medication can also mimic pregnancy symptoms. So, if you are taking fertility medication and experience symptoms similar to pregnancy before your period is due, it might be due to the medication. In such case, the symptoms do not indicate pregnancy. Number 3. Psychosomatic symptoms. When a woman attempts to conceive and fail after 2 to 3 tries, the desire of pregnancy becomes intense. The longing for conception becomes so intense that thinking about anything other than pregnancy becomes very difficult. There is a mental breakdown. Additionally, when researching pregnancy symptoms on the internet, due to excessive anxiety, some hormones may be disturbed, leading to missed period at time. During such time, any symptoms in the body is perceived as a sign of pregnancy. Nausea, mild fatigue, abdominal discomfort, everything seems to be interrupted as a sign of pregnancy. Some may also mention feeling the baby kick. They do not want to understand that It might be gas-related problem or due to other reason. C. The perception of nausea, mild fatigue, breast and abdominal discomfort, dizziness, or sign of pregnancy is not necessarily an indication that you are pregnant. It might be symptoms similar to pregnancy that you are thinking about, but actually they are not pregnancy symptoms. Therefore, even after having symptom of pregnancy, period may occur. Usually these are not symptoms of pregnancy. So, what should I do after having this symptom? In summary, if you experience sign of pregnancy, wait for 10 days after missing your period. If your period does not occur within the first 10 days after missing, performing a pregnancy test using the first morning urine sample. If the test is negative, wait 3 to 4 days and test again. If the remaining negative, understand that your period might be irregular. If your period occur within the initial 10 days, it likely not a pregnancy. However, if after waiting 10 days there is no period and pregnancy test result is still negative but you are experiencing pregnancy symptom, then it is essential to consult a gynecologist and consider undergoing an ultrasound. If the pregnancy test is positive during this time, so don't worry, you are pregnant, alhamdulillah. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.